So now we'll kind of dive a little bit deeper and we'll talk about WaveOn. What WaveOn creates is an opportunity for the athletic trainer to do something that's never been done before. So if we talk about the why or the purpose behind WaveOn, we have to look at the authenticity of athletic training. The authenticity of athletic training is, I always say, the high school model, where they're the point of care for these athletes. And they have a linear relationship with those athletes when they work at a high school. It's an athlete, an athletic trainer, then they become friends, and then that athletic trainer becomes the point of contact for kind of their overall healthcare. It doesn't mean the athletic trainer is the expert. It just means the athletic trainer is the first person that the athlete talks to, because we're on the sidelines, we're on the bus, we teach classes, we're always around them. They can text us, email, phone, FaceTime, whatever the case may be. So the athletes contact us. They are able to ask us any questions when we can't help them anymore based on scope of practice or skill set. We then have the next level provider in our cell phone to give them accessibility to them. So the reason that's so important is that is what I like to call an access model, that athletes have unlimited accessibility to the healthcare system, with the athletic trainer being the point of contact. And the reason that's so unique and so innovative, within athletic training, we're always discussing two other value sets, which is that coverage versus care model. And both of those work and they're both beneficial, but they're not revenue generators. So the purse strings are always looking at, do I really need you to cover an event all weekend if nothing happens? What if I just have EMS on call? And then for the care model, an athletic trainer, doesn't matter how good they are, how bad they are, how much they work, how little they work, they're not a revenue generator. So there's no money to pay the athletic trainer more. And I'm not decreasing the value, I'm looking at it from the economics of the position. And that is why athletic training is in complete turmoil right now. That all these companies, when this virus starts to dissipate and it starts to calm down and people go back to work, the people that don't generate revenue are the ones that are not going to get a job back. And there's a huge concern about athletic training moving forward, because some of these clinics are going to say, hey, I'm just going to hire a PTA because we can bill for them. So WaveOn is saying, okay, let's look at this access model within organized sports. And that is high school, college, pro, and it exists. If you step out of that environment and you go to recreational sports and club sports, their model is urgent care, the emergency room, getting referred to a PCP, unnecessary visits, unnecessary imaging, long-term referrals to specialists. That whole system is upside down. We all know it. Whereas within organized sports, it's a system based on improving patient outcomes, decreasing time, specialists win, right? Everybody benefits within that model. So what we're doing with WaveOn is we're taking this national network that already exists. In every single city, there are sports medicine teams that are already established. We're picking up this fabric, we're dropping it into the public, we're overlaying technology to streamline the healthcare system, improve patient outcomes, decrease the cost. And we're doing two major things within WaveOn. One, for the athletic trainer, we are empowering them to be the point of contact, the center of influence for the sports medicine community in their town or city. And then for the end user, which is a 15-year-old to an 85-year-old active individual, we are redefining their experience for millions of recreational and amateur athletes. So we're creating a whole new experience. We're not trying to change the healthcare system, that's impossible. But we're giving all these athletes that are runners, triathletes, soccer players, weekend warriors, CrossFitters, no matter who it is, they all have musculoskeletal injuries. And more importantly, they have discomfort. So if we look at the traditional setting, the most valuable piece of athletic training is athletes have access to us at the earliest onset of discomfort, which is really a prevention model. If you look at the regular health system and the public, They don't have access to anything like that right now. What they have access to is the whole healthcare system that costs a lot of money, takes a lot of time. So through customer discoveries, we've talked to hundreds and thousands of athletes and coaches. All people want at the bare minimum is they just want to have access to advice. Hey, I was in the gym today and my shoulder's starting to hurt. What should I do? They just want to know how and what they should do in the moment. And if they need a referral, the athletic trainer can get them expedited through the healthcare system. So that's kind of like the nuts and bolts of how Innovate AT leads into WaveOn. Innovate AT is going to be our credentialing and quality assurance component, because we can't let every athletic trainer do this. They have to be qualified. And because we're creating a whole new industry with WaveOn, it's literally not even athletic training anymore. Athletic training was defined by the American Medical Association in the 90s as really working within organized sports. We're doing something different. So we're creating a whole new industry, but the individual professional who has ATC as the credential, that's our foundational requirement. And then we'll be building additional requirements on top of that overall skill set. So it's a big undertaking, but we have huge momentum. The technology partners building out, the entire platform right now. We're scaling up, and it's exciting. It's exciting times. So when we talk about this virus, the reason this is important is, what if athletic trainers don't get jobs back? Well, we are leveraging the thousands of relationships that athletic trainers already have with the active population within their community, city and state and town, and to help them really leverage the opportunity to be that point of contact and that center of influence within their community. So with that, I'll kind of leave it open to questions if you guys have